Hello everyone, welcome back to part 2 of our series on the muscles of the lower limb. In this video, we will continue our study of the muscles of the hip and thigh region. Today, we are going to learn about the superficial gluteal muscles. The superficial gluteal muscles group consists of four main muscles. They are gluteus maximus, gluteus medius, gluteus minimus, tensor facial lata. Let us discuss each of these muscles one by one. The first muscle, the gluteus maximus muscle, which is the gluteus maximus originates from the posterior part of the hip bone and the vertebral column. Its main origins are the posterior surface of the ilium behind the posterior gluteal line, the posterior surface of the sacrum, and the posterior surface of the coccyx, also known as the tailbone. And its insertion, the gluteus maximus inserted into two main structure. First one, gluteal tuberosity of the femur, that is, this is the rough area on the posterior surface of the femur where many of muscles fibers attach there. And second one is iliotibial tract. This is the strong band of connective tissue located on the lateral side of the thigh, and the upper fibers of the gluteus maximus inserted to this tract. Okay. Thus, the gluteus maximus originates from the ilium, sacrum, and coccyx and insert into gluteal tuberosity of the femur and iliotibial tract. Remember this. And this muscle is also known as buttocks region muscle mainly. Gluteus maximus muscle is supplied by the inferior gluteal nerve, and the blood supply to the gluteus maximus is provided by the superior gluteal artery and inferior gluteal artery. Functions: the gluteus maximus is the largest and most powerful muscle of the gluteal region. Its main functions are extension of the thigh at the hip joint, lateral rotation of the thigh, assist in abduction of the thigh, especially through its upper fibers, and stabilization of the pelvis and trunk during standing, walking, and running. Therefore, the gluteus maximus plays an important role in activities such as climbing stairs, running, jumping, and raising from the sitting position and all. Second muscle, gluteus medius muscle. The gluteus medius originates from the gluteal surface of the ilium, which is between the anterior and posterior gluteal lines. And insertion, it inserts into the lateral aspect of the greater trochanter of the femur. And now supply, the gluteus medius is supplied by the superior gluteal nerve carrying fibers from L4, L5 and S1 spinal nerve roots. The blood supply is provided mainly by the deep branch of superior gluteal artery. Functions, the gluteus medius performs the following functions. There are abduction of the thigh at the hip joint, a medial rotation of the thigh, and stabilization of the pelvis during standing and walking. Gluteus medius is especially important for maintaining pelvic stability during single leg stands, such as during walking and all. And important exam point, remember this: weakness of the gluteus medius can lead to Trendelenburg gait due to failure of pelvic stabilization. Third muscle, gluteus minimus muscle. It originates from the gluteal surface of the ilium between the anterior and inferior gluteal lines. Insertion, it inserts into anterior aspect of the greater trochanter of the femur. And now supply, the gluteus minimus is supplied by the superior gluteal nerve. So blood supply, it's provided by the superior gluteal artery. Functions, the gluteus minimus performs the following functions. They are abductions of a thigh at the hip joint, medial or internal rotation of the thigh, and stabilization of the pelvis during standing. Together with the gluteus medius, the gluteus minimus helps maintain pelvic stability and support normal gait. Fourth muscle is tensor fascial lata. The tensor fascial lata originates from the anterior superior iliac spine, that is ASIS, and inserted uh, into the iliotibial tract, which continues down to attach to the lateral condyle of the tibia. Then nerve supply, the tensor fascial lata is supplied by superior gluteal nerve. Blood supply is provided by the ascending branch of the lateral circumflex femoral artery. Functions, it flexes the thigh, abducts the thigh, and medially rotates the thigh. And at the hip knee joint, uh, through the iliotibial tract, okay, helps stabilize the knee during standing and walking, assist in maintaining stability of both hip and knee joints. Therefore, the tensor fasciae lata plays an important role in posture, gait, and lower limb stability. Now let us move on to the most important part of my video, the note point. In this section, I'll share some simple tips to help you remember the topic easily. First, what is the iliotibial tract? The iliotibial tract is also known as the IT band. It's a thick band of connective tissue that receives fibers from the tensor fasciae lata and gluteus maximus muscle, which extends down the lateral side of the thigh and attached to the tibia. Okay. Then most of the superficial gluteal muscles are involved in abduction of the thigh, rotation of the thigh, stabilization of the pelvis during standing and walking. The gluteus maximus is different because its main action is extension of the thigh at the hip joint. Okay, remember this. And another important point is blood supply. The gluteus medius and gluteus minimus are mainly supplied by the superior gluteal artery, and the gluteus maximus is supplied by both, that is superior gluteal artery and inferior gluteal artery. Gluteus maximus is innervated by inferior gluteal nerve. Other three muscles are there, right? Gluteus minimus, medius, tensor fasciae lata. They are innervated by superior gluteal nerve. So remember this point. And gluteus minimus and medius muscles, origin and insertion are same. Okay, remember this point. Origin from gluteal surface of the ilium and insertion is greater trochanter of the femur. So you can remember the origin and insertion of two muscles in one memory tip. So that's all for today's topic on the superficial gluteal muscles in part 2 video. In the next video, that is part 3, we will continue with the deep gluteal muscles and learn about their anatomy and functions. Thank you so much for watching this video. If you found it helpful, please like, share and subscribe to my channel. If you have any questions or doubts regarding to this topic, feel free to leave them in the comment section below. I'll be happy to answer them. Thank you and see you in the next video.